We're excited to reshare this powerful conversation with nutrition expert Katie Mednick, all about the role of nutrition in Ehlers-Danlos Syndrome. If you or someone you love is navigating EDS, this episode is packed with practical tips, real science, and insights that you probably haven't heard anywhere else. Let's revisit this incredible conversation. Welcome to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. I am so excited to have Katie Mednick with me today for this episode of Ask the Patient Advocate podcast. Today, we're diving into an incredibly important topic, nutrition and its impact on managing chronic conditions like Ehlers-Danlos Syndrome, also known as EDS. I'm so thrilled to be joined by Katie today, who is a registered dietitian and EDS expert who has firsthand experience with the condition and has dedicated her career to helping others manage their symptoms through nutrition. So, Katie, thank you again for joining me. How are you doing today?
I'm well, thank you. I'm excited to chat a little bit about nutrition and EDS and also learn more about patient advocacy because I want to learn more too.
Oh, awesome. Awesome. All right, let's start talking then. So let's start with your personal journey. You were diagnosed with hypermobile Ehlers-Danlos syndrome, also known as HEDS, fairly young age, which must have been both validating and challenging. Can you share more about how your diagnosis led you to focus on nutrition and ultimately become a registered dietitian?
Yeah, of course. I think my story is really similar to a lot of EDS patients. So if you're listening and you're like, "Ooh, same," it's because I think a lot of us kind of fall on this similar journey.
Mhm.
But I'm a twin, so
Oh, interesting.
we had the joy of both getting EDS, but from essentially birth, we both had different but apparent things going on. Like for instance, I had really bad GI issues, which is probably unsurprising to hear from a dietitian, but I really couldn't keep food down even from the first day on. So I had an issue with like vomiting pretty regularly. My sister had other issues, and a wider range of things, right? Like joint pain, migraines, being really tired when our friends, of the same age wanted to
Mm.
swim laps or run around the playground. My sister and I had no interest in
Oh,
any of that.
wow.
Yeah. And so we both were interested in kind of health in the body from a really young age. And I took really well to biology. And I remember in ninth grade, we had this project to kind of look up genetic disorders and do a project on it. And kind of on a serendipitous whim, I kind of typed in all of my complaints into Google,
Oh, wow.
and the EDS Society's webpage came up with a list of all of, the symptoms. And I think that list at the time, this was more than 10 years ago, there was like 25 symptoms. And I was like, checked a green box on like 20 of them. And I went to my mom and I was like, Mom, I really think Christina, my sister, and I should be like evaluated for this. This is crazy. And, at the time she's like, I don't know, like, Dr. Google, I don't know about shortly after my sister tore both of her rotator cuffs, just like reaching for something. And so I went to a doctor's appointment with her at like an orthopedist, and I kind of mentioned Ehlers-Danlos syndrome, and he was like, "Ooh, yes, you guys should really get evaluated for this."
Oh my. So you
Mhm.
essentially diagnosed yourself, which is amazing. And to be honest, I really like that when people, take autonomy over their health and things like that, because
Mhm.
nobody knows your body better than you, right? And so sometimes, I come across clients where they're like, well, I don't want to search it. I don't I don't want to Dr. Google, whatever. If
Mhm.
I go to a doctor and they tell me this, then they must know what they're talking about. Which you go to a professional, you're taking that opinion, but that's not always the case because you can't know everything about a person in a 30-minute visit or 1 hour visit, right? Being
Mhm.
yourself, you know your symptoms the best. So I think it's so important to speak up and, explore symptoms and concerns if like you did. So that's amazing.
Absolutely, absolutely. And I think because there was 2 of us, there was more of
Yeah.
a signal that something was maybe not quite right because both of us, had our fair share of issues that were completely different, which is kind of unique in the EDS world, like, for other
Yeah.
conditions, right? Like, if you have sickle cell anemia, you have sickle cell anemia, there's not this huge range of
Right.
symptoms.
Right.
Whereas my sister, like, she tears, she gets hernias, that kind of stuff. And I've never torn anything. I've never, anything like that. But my fingers are much more hypermobile than hers. So even like within the EDS population, like one person with EDS could have pretty different symptoms than someone else. And I think that doesn't help our case as
Sure.
being diagnosed. But certainly everyone knows their body best and should advocate accordingly, certainly.
Yes, definitely. So are you and your sister identical?
We're fraternal.
Oh, okay. Okay, interesting.
Yeah. Yeah,
Yeah.
but I think HEDS is like an autosomal dominant inheritance
Mhm.
pattern, so 50-50 shot, and
Yeah.
unfortunately, we both, didn't luck out on those odds.
Wow, that's even more interesting.
Mhm.
So okay, my next question. Nutrition can be incredibly overwhelming for people with chronic illnesses, especially when dealing with symptoms like GI symptoms, which that include like stomach aches, nausea, reflux. So, what are some common misconceptions about diet and EDS, and how do you help your clients kind of understand that confusion related to that?
Yeah. I think GI symptoms is not talked about enough in this patient population, so I'm glad you're mentioning it. And research is suggesting that like anywhere between 30 to 90% of people with EDS do experience GI symptoms. So like
Oh, wow,
best
that's
case
high.
scenario, like one third of us, and worst case scenario, it's like mostly all of us.
Yeah.
So hugely important. And I don't think doctors talk about it enough. I don't think it's addressed enough, which is why I'm really passionate about this space. But in terms of misconceptions, oh goodness, there's a couple, but I think the most important to mention today would be that I think there can be this like, you're wrapped up in trying to feel better, right? You're
Sure,
like
sure.
desperate to feel better. And there's this assumption that if you remove certain foods, that maybe one of those foods was like that trigger
Mm,
for, your terrible, GI upset or your terrible nausea or
mhm.
your stomach aches or your bloating. Like maybe I'll just take out dairy and maybe I'll just take out gluten. Okay, I still feel bad. Okay, maybe I'll take out beans and I'm going to try the low FODMAP diet and I'm going to do like a low histamine diet and, like all of a
Yeah,
sudden left with so few foods. And unfortunately, with us, it's not that simple that it was just one food, driving all the
yeah,
symptoms. There's something physiologically going on. And typically, physiologic problems need to be addressed a little bit differently than with a simple diet modification. Diet modifications can certainly play important roles in very specific scenarios, like if you really feel lousy after having something with wheat or gluten every single time, it's like cause and effect. Sure. Like
of course.
we don't want you feeling lousy. But
Sure.
if you feel the same when you eat wheat and gluten versus when you don't, then it's that wasn't the problem and that we should keep looking for the problem.
Mm,
And with, trying to find those food triggers and feeling desperate to feel better, what I see most often are folks who are like, well, I eat these like 10 foods now because I'm trying all these different diets and trying to figure out what's going on. And now I feel super tired. Now my hair is falling out, and they have these signs of nutrient deficiencies and malnutrition, even being underweight, because they were trying to help themselves, by minimizing potential things that could be contributing to their symptoms, but that's not ideal in the long run because we need nutrition. We need 3 nourishing
Sure.
meals most days, right? Our bodies are counting on it,
Yeah.
and when we don't get enough, we don't feel well.
No, that's a very good point that you brought up. Yes, it's hard to everybody wants a quick and like easy fix because,
Mhm.
you get to feeling better quicker, but it's a lot of times it's much more complex than that. And I know like your website and so forth, you've mentioned in the past you focus on like anti-inflammatory foods, which include like fruits and vegetables and whole grains and so forth. Could you walk us through like why specifically those foods? Like how do you explain to your clients like they reduce inflammation and so forth?
Ooh, good question. So I typically focus on kind of the talking about anti-inflammatory foods like after someone is in a safer place, when
Mhm.
it's like a good time to talk about that. If someone has terrible GI symptoms, they're struggling with a lot of nausea and vomiting, they're like, oh, well, it's just not clinically appropriate to be talking about, salad at that point. Like, we got to talk about just
Yeah.
getting them their basic needs. But when someone's ready, when they can eat well most days, they can eat enough, then we can start talking about anti inflammatory nutrition, which I love because I think it made such a difference for me personally.
Sure.
Um, there's very little research in this area, so I don't want to say it's like an evidence based, practice.
Mhm.
But physiologically, our bodies take components from food and use it for the anti inflammatory process, like in the body. So, for instance, everyone's familiar with omega-3 fatty acids, being kind of anti inflammatory. Yes, they are. Like our bodies want that from food. It's essential. We cannot make omega-3s. We have to get it from food. And it's like one of the most important components in the anti-inflammatory process.
Mhm.
So if someone is struggling with, inflammation and chronic pain, which so many of us are, I think it's really imperative that we get those compounds from food that are a part of that anti-inflammatory process. Same thing with antioxidants. It's another compound that are anti-inflammatory. Some vitamins, like vitamin C, is an antioxidant, for instance, and then
Mhm.
even fiber can play an important role in combating inflammation in the GI tract specifically because our gut microbes eat fiber and they produce really important compounds that reduce inflammation in our body. So it's like there's so many things that can reduce inflammation or are naturally a part of those processes. So by, enjoying a variety of foods like fish and beans and fruits and vegetables, nuts and seeds, all of those things, it's not risky, right? They're very nourishing foods
Yeah.
and we get the benefit of them kind of combating inflammation just naturally. Like that's what our body's counting on. So we've got to get in some of those nutrients and those compounds to kind of help our bodies with that.
That makes total sense to me. I think that you explained it so well. That's great. No, that's really good. I mean, it totally makes sense. So, for our listeners who might be struggling to figure out their diet, especially our listeners with EDS or related conditions, what advice would you give them to take, like, as the first step toward better nutrition? And how can they work with you if they're interested in like a personalized support?
Good question. So I think the like first steps would be getting more support. Like so many people who've come into contact with me, like they're in a place where they're pretty vulnerable. They've lost a
Yeah.
lot of weight. They're on a really restrictive diet. Maybe they really struggle with nausea and vomiting to the point like it impacts their life. So ideally, we'd be getting support before we're in such a scary place. But of course, wherever you're at, that's the next best time to take steps. So, getting in with a gastroenterologist and of course, I'm biased, a dietitian, to provide that kind of guidance, support. Like a gastroenterologist can help with, diagnostic processes and prescriptions and other things like that. Whereas a dietitian, our wheelhouse is keeping you safe, keeping you nourished, and providing a lot of creative ideas and strategies to do those things. So if you're not getting the support you need from your gastroenterologist for nutrition, it's because you're missing a dietitian in that kind of equation. And in terms of how they can work with me, I'm kind of in the middle of creating a new program, which will include like one-on-one nutrition coaching as well as kind of this core curriculum
Oh,
that really
wonderful.
dives in. Sorry, what did you say?
I said that sounds wonderful.
Yeah, it's gonna be good. I'm excited for it. But this core curriculum kind of dives into like four main pillars, like addressing GI symptoms, adding in symptom management strategies,
Mhm.
and adding in anti-inflammatory nutrition. And ooh, am I gonna forget the other one? Oh, adding in nutrition to combat fatigue, because that's one of the most common
Oh, yes, yes.
for
And
ESers.
it's that's so important because, I have had over the last probably 4 years, so many clients of mine, through Pathway Patient Advocates where, they've either come with, a bit undiagnosed and we kind of work through and they get to the diagnosis of EDS, or they'll come with me, to me with a known diagnosis, let's say, for instance, POTS. And I see such a correlation or
Mhm.
trend, I should say, um, that, they have POTS and then all of a sudden we also discover they have EDS. And so it's, a lot of times they don't have just one condition or they have a known condition. So then the symptoms of EDS are overlooked because they think it potentially is due to the known condition. So we it's very multifactorial, I guess is
Mhm.
my point of that. And so I work with EDS patients very frequently, and
Mhm.
I can definitely see the benefit of working with a dietitian because it is, the GI system plays such an important role in it. So, do you think that uh, a private patient advocate could help your patients in their journey?
Absolutely. And when I was thinking about this question, I think two main things come to mind, one of which I know I'm guilty of, but we feel like this is normal because this has all been our whole life, right? Feeling
Yeah.
lousy and not getting many answers. So I think having like a third party to be like, whoa, 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 whoa. Like you might be rolling this under the rug and you might be okay with where things are at right now, but like you would benefit from more support. And these are your
Yeah.
next steps to like help address the symptoms you're experiencing or pursuing a diagnosis, things of that nature. So I think that part is helpful, as well as like what we were just talking about, being like extraordinarily fatigued.
Yeah.
Really impacts our ability to go sit on the phone with 49 people to go get a prior auth for
Yep. Yep.
one procedure. And so like totally, totally, totally. Definitely.
Yeah.
Do you find that those two things are accurate, or are there anything else?
Yes. No, for sure. Those are two very, very important things that you mentioned. The fatigue is a huge factor. And I know like some of my patients, they can only really they know their bodies where they're really fully functioning for like an hour and a half a day, let's say.
Yeah.
So they have to maximize what they're gonna do each day in that full functioning an hour and a half. And so like if we're making an appointment, we have to make sure that we're not making two appointments that day because the second one isn't going to likely happen because of their
Mhm.
fatigue or try to make things virtually when we can and it's difficult too because it's almost like if there's a really important or difficult appointment to get that's coming up, we kind of have to strategize of like, okay, let's make sure we're doing everything so we can optimize
Yes.
the outcome of this and so forth. So it's so it's very multifactorial, and I've really learned a lot more about EDS over the years just because like you had mentioned earlier, every patient has such different symptoms that it's not just like textbook, like these are the symptoms for EDS. So, this is what you can expect. They don't, they do vary quite a bit.
Definitely, definitely. Well, we're lucky to have people like you to help
Oh,
us.
thank you. Well, we're also lucky to have people like you. So, how can our listeners get in touch with you if they're interested in learning more? Can you share your social media handles and like the best way to contact you?
Absolutely. So the best place for announcements, including my upcoming program, which will be called EDS Symptom Relief Academy, will be by signing up for my email list. So if you go
Perfect.
to my website edsnutrition.com, you'll see like a little form that says sign up for the accessible nutrition newsletter. So of course sign up if you want accessible nutrition tips, but also that's kind of how I keep in touch with folks when there's announcements coming up. And then I also post regularly on Instagram. So feel free to pop over to at EDS Nutrition to come say hi and to see some of the stuff I'm posting there, usually about, EDS and nutrition, and occasionally some other vignettes as I get nerdy about nutrition. And those are the two main places. And then if you want to send me an email, it would be edsnutrition@gmail.com.
That is amazing. So I did have one question I just thought of. So,
Yeah.
my clients are all throughout the US as well. We have some in Canada as well. Where are you physically located, and do you only see clients in that state, or what clients actually are able to connect with you
Good.
demographically?
Super good question. So I'm physically located in Iowa, of all places, but I'm from California, then was in Chicago, now I'm in Iowa. So
That's a big shift.
I've been around, yes. Um, Previously, I was seeing patients one-on-one
Okay.
for medical nutrition therapy. So there were boundaries of where I could see patients, because it all depends on where the patient is located
Yeah.
or licensure laws. But since I'm moving to this new program, which will be more nutrition education based,
Okay.
there will be no restrictions on the physical location of the client. I just can't provide medical advice, but I can provide coaching and, definitely resources for everyone to answer the questions that the majority of us have, as well as, some lifestyle coaching, things of that nature.
That's wonderful. That's amazing. That's great. And so your visits are then virtual, is that correct?
Yes, everything's virtual.
Perfect. I love it. I love it. That's wonderful. Well, thank you again for joining us today, and thank you for allowing our listeners to meet you. Please reach out to Katie or myself for any further questions, and enjoy the rest of your day. Bye.
Thank you.
If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.